just to give you a bit of more background, I recently looked at the latest figures from the World Health Organization on childhood obesity, just to give some perspective. And currently, or the latest figures are from 2016, 41 million of infants and young children under 5 were overweight or obese. This rises to over 340 million children, adolescents aged 5 to 19. So this is a lot. So nearly 1 in 5 children and adolescents are overweight or obese at the moment. I looked at some facts, because one might say, well, is that really so much of a problem? What does it actually mean? Is this just a cultural shift in what we perceive to be healthy looking or beautiful? But actually it's not, because those children that are obese or seriously overweight as infants and young children are very likely to continue to be obese throughout their lives. That is associated with a range of illnesses, including cardiovascular disease, insulin resistance, which often establishes as diabetes in later life, musculoskeletal disorders, some cancers, and it can even lead to disability. And I don't know if many of you have heard about this. Actually, at the end of 2014, the European Court of Justice found in a case against Denmark that, at least in the employment context, serious obesity could be classed as a disability. Unfortunately, we didn't get any proper information by the Danish government on in what circumstances specifically, because it was referred back to the national courts, but it's an interesting aspect to consider in this discussion. But today we want to also think about the role of the state, the systems that we live in, the parents, and maybe other factors that can contribute to the increase, the significant increase in obesity across the world. And I just mentioned the figures, but the interesting thing was, compared to 1990, it was an increase of over 10 million children that have now been classified as obese in just 30 years. Almost 30 years. So this is quite significant, and the situation for adults isn't much better. Okay, I don't want to say so much more about this now before we've heard from our experts. So I'm very happy to introduce these three nice people to you today. There's Katharina Okaha. Sorry, the name is Irish names are difficult. She's currently a postdoctoral research fellow at the Faculty of Law at the University of Copenhagen, and she wrote her PhD on children's right to freedom from unhealthy food marketing as part of an interdisciplinary research project on obesity prevention and treatment, so a very topical issue. And her research focuses on the intersection between human rights and health, in particular the prevention and treatment of non-communicable diseases like obesity. She's going to talk about the state's obligations and, to some extent, maybe private sector corporations in this problem of childhood obesity, and is asking the question of what are those state obligations under the right to health, and how do those obligations interact maybe with parents' obligations towards their children. Then we have Sveinung Nygård, my colleague. He works at the Office for Children, Youth and Family Affairs here in Norway, and he's also a researcher at our Center for Research on Discretion and Paternalism. And he's a specialist in clinical child and adolescent psychology. He's also worked as an expert witness for the court and as a member of the County Social Welfare Board. And he's going to take the perspective of the parents and parents' responsibilities, and also the state responsibility, I guess, to some extent. And he's going to ask the interesting question of who's to blame. Is it parents' fault if children get obese or not? And how do we intervene in this problem? And then last but not least, we have Camilla Gianella. She's a researcher at the CMI and a global fellow at the Center for Law and Social Transformation. And she's part of several projects tied to the center and focuses, amongst other things, on the right to health. And she's going to provide a perspective from the Latin American part of the world. So welcome, and over to you, Katharina.
I'm definitely going to fall off this. Thank you very much, and thank you for inviting me here to talk about my favorite topic, which is childhood obesity and the right to health. I wrote my PhD related to this, and I've written a lot about this, so it's a bit tricky to know how to limit what to say. So I've tried to make it quite light, because everyone's tired, I think, and also you're sort of at the end of a week. So when I first was employed on this project, which is called Governing Obesity, and which relates to the role of the state and the role of responsibility in obesity. I decided to focus on children and specifically, what is that sound? Can you hear it? Okay, it's okay. I decided to focus on children specifically because children, as we all know here, are a vulnerable group. And when I thought, how do we frame states' obligations in terms of children, I turned initially to human rights, children's rights, and the Convention on the Rights of the Child. So that the Convention has very much been a focus of my research, although I've done some national case studies, which I'm not going to talk about here. So the primary issues, as I see it, or that I've looked at, are what are states' obligations, how do states' obligations interact with parents' duties, and how can public health and human rights combine or cooperate to prevent childhood obesity. Because we have to think of childhood obesity as primarily a public health issue. So this is not an issue that human rights or law alone can solve or fully address. It needs to be a combined approach. So I thought for this talk that I will discuss 3 myths surrounding childhood obesity and respond to them using the convention. And then, just for it to rhyme, I said 3 maps, road maps. So to start with my 3 myths. So I think that the number 1 myth, or one you've definitely heard before, is that it's all about the parents or it's only up to the parents. And that's not, I don't want to neglect the very important role that parents, of course, have in providing for their children's health and in supporting their children. That's not at all what I'm saying here. What I want to argue, however, is that the state also has obligations namely to support parents. And this is because parents can't control everything, as those of you who are parents will well know. So there are many aspects of childhood obesity that are well outside the individual's control. And these include, for one, marketing of unhealthy foods to children, which is very widespread, and this has been established through a series of systematic reviews by the World Health Organization. But furthermore, issues like pricing of healthy and unhealthy foods. We all know that it's quite often much cheaper to buy a very unhealthy meal for your children than to go and buy the beautiful meals that you want to, of course, provide for them. And these aren't things that a parent alone can solve. So putting all the blame or the responsibility on parents is ineffective, and it's just pushing the can down the road. And this approach is supported by the Convention on the Rights of the Child. While the Convention does speak of the parents as having the primary responsibility, it also acknowledges that states have duties to support not only children, but also parents in fulfilling their obligations towards children. Okay, so a second myth is, as I call it, those lazy kids just need to run around. And we've even heard this from childhood obesity advocates like Michelle Obama, for instance, who said, well, it's not that difficult. They should just run around. Well, try living in some places in the US and start running around. First of all, your parents won't let you go outside because it's too dangerous. And also there may be nowhere where you can actually run around. And also to focus exclusively on physical activity is, again, just a smokescreen. And physical activity is extremely important for our health in general. And it is true that physical activity has fallen. And this is something that needs to be discussed and addressed. But again, it's not something, if we consider the statistics that you noted earlier, do you think that all these parents in the last 30 years have just become incredibly lazy and all the kids are just lazy children? No, there must be other structural environmental factors at play here, right? And another thing to mention is that this argument about physical activity being the sole answer here is very heavily advocated by the food and beverage industry. And that will bring me to my next myth, which is that big food, as it's called, will act in children's best interests. So for those of you who aren't in the health world or the big food world, the top 10 food and beverage companies have a lot of control over what is sold and what is marketed. They have a very large market share, not just in Norway or in Europe, but actually all around the world. And this is only expanding, as I believe you're going to discuss. And these companies are now as more and more rich countries will bring in regulations, these companies are moving their practices to developing countries where there may be less political will or where law may not be an effective regulatory tool to enter these markets and to really get in. And this, of course, becomes extremely problematic, or even more problematic, when you have malnutrition or when you have undernutrition side by side, overnutrition. And if you consider what resources Norway has, and yet we see very little change, consider a country that has very limited resources and how they're actually going to address this problem. And this isn't just my perspective, it's not an opinion, it's actually really established by evidence which has shown, for instance, that when the food industry self-regulates, as they call it, the standards are much lower, they're not monitored, there's no complaints mechanisms. Unhealthy food that's classified as healthy might be something like a Mars bar, for instance, and that there's actually no evidence to show that self-regulation in the field of unhealthy food is as effective as regulation. There's just no evidence for it. But unfortunately, as Helen's already mentioned, human rights has not been particularly effective in this area to date. So we have some non-binding guidelines, which are the guiding principles on business and human rights. And these are basically corporate social responsibility, and different companies sign up to these principles, and they agree to protect, respect, and remedy human rights violations. I've done a review of the top 5 food and beverage companies' policies, human rights policies, and they don't engage with unhealthy food at all. So when Coca-Cola or Pepsi puts forth their human rights report, they don't consider the right to food or the right to health relevant to their business, which when you consider the whole function of their business, I find very troubling. Instead, they will focus on, for instance, child labor, and they will say, we've made these and these improvements without actually addressing the impact of their products. The World Health Organization has similarly been very ineffective in defining and articulating how the relationship between the state and the food industry should function. So right now, we have a lot of partnerships that are very ill-defined, and we can't actually see the public health benefits. What we can see is the publicity benefits for the companies. So from the negativity to maybe some positivity, probably not. So one argument is that states have legal and moral obligations in the field of childhood obesity. I argue this not just because it's my opinion, but actually because it's borne out in recommendations of the Committee on the Rights of the Child. So they have discussed states' obligations to childhood obesity in 3 different general comments, all in 2003, so time is ticking on. And there have also been a number of concluding observations. So these are specific recommendations from the committee to specific states on childhood obesity. I have been kind of critical of these recommendations because I don't think that they are adequately specific, and I don't think they are clear enough for states, but they do exist, which does buttress the argument that childhood obesity or preventing and treating childhood obesity is part of the state's obligations. The Special Rapporteur on the Right to Health, or the then Special Rapporteur on the Right to Health, has been much more to the fore in advocating and arguing that states have responsibility, and he laid out much clearer responsibilities. So in a forthcoming book chapter with my colleague, Professor Mette, we've compared the human rights and the public health approaches in terms of childhood obesity. And actually what you see is a lot of similarities. So a lot of the WHO's recommendations, and these specific recommendations come from a report from the Commission on Ending Childhood Obesity. And they make a lot of specific evidence-based, which is important, recommendations for what states should do. And the report, even though it's a WHO report, also mentions children's right to health. So we see some interactions between public health and human rights here. But I would also argue that it's not sufficient. So we could see much more working together between the Committee on the Rights of the Child, much more drawing on this set of recommendations, which do not go, which are not against or in contradiction to the human rights approach, given that they have been recommended by different experts. But finally, the most important or most necessary factor here is really political will. We have international obligations. We can say the Committee on the Rights of the Child, we can say all the UN experts in the world should say this and that, but that doesn't actually make up for the absence of political will in this area. And together with my colleagues, we've discussed 3 different reasons why this political will has been missing. One, as I've mentioned, is the insidious influence of the food and beverage industry, who very aggressively lobby against regulation and are very effective in doing that. So here, McDonald's, what a great company, they're sponsoring physical activity yet again. Another issue here is a lack of political or mobilization. We don't see people protesting. We don't see the citizens really passionate and angry about this issue, angry about what's happening in our food system. And the final issue is a fear of litigation. So advocates, but also academics in this area are very concerned that the food and beverage industry will bring litigation, which it has the ability to do because of obviously all the money it has. And obviously we've seen this previously in tobacco control. But here we need to also consider that this is even more why we need evidence-based and we need proportionate regulation in this area. So it's not enough to just be afraid of litigation. We need to actually come with effective laws that that aren't going to be struck down by a court. And here an issue becomes relevant, which we haven't really talked about today. And that's, of course, that I can stand here and argue all I want about children's right to health, but many of our constitutions don't actually recognize the right to health, and they are very much focused on civil and political rights. So in the litigation, we will see a lot about companies' rights to freedom of expression, for instance, and it was very much focused on civil and political rights. So this is a real challenge in this area, but I wouldn't say that it's an obstacle that's not able to be transcended, but it's just something that we need to be aware of when we argue based on the right to health. This situation is slightly different in other countries, particularly in the global south, we can argue, for instance, where many constitutions do actually have a right to health. So there is actual potential, I would argue, for interesting and hopefully consumer-friendly case law. So I'll leave you with a quote from the Brazilian Superior Court. And here the court is advocating very much for viewing this issue in terms of autonomy, which sort of ties into the previous discussion we've had. And here the court says that decisions about food, just as with medicine, should not be taken by suppliers. The Superior Court of Justice needs to tell not only Baduku, that's the company, but the whole food industry that enough, no more. The argument that there's no risk to health and safety, which is not the only criterion of the Consumer Protection Code. Where is a child's autonomy of will? And this is very much arguing against the food and beverage industry deciding for children and actually the regulator creating a space for children and their parents to make food and beverage decisions. So as I mentioned, this was research was funded by Governing Obesity, which was an interdisciplinary research project at the University of Copenhagen. And some of this is my own research, and some of this also reflects publications that I've written together with my colleagues, Mette Hartliv and also Celine Brazar-Olsen. Thank you.
Yes. Can everyone hear me okay? Yeah, perfect. First, I'd like to thank you, Katharina, for a very interesting talk, and it was quite an eye-opener for me. Contrary to you, I haven't done any specific research on children and obesity. I'm sort of representing a clinician's point of view at this topic, and I will try and do a comment and touch upon some themes that hopefully can be further developed in a discussion afterwards. It was said that I was going to answer the question, whose fault is childhood obesity? I don't think I can do that by myself, but I think that is one of the things that when it comes to state intervention and child protection services, at least, it's sort of a question that comes to mind for a lot of people. Is it the parents' fault? Is it the and how does that work? So I'd just like to start to say a few words about what is known about cause and etiology, and this does not touch upon this is just stem from research that is done with children that are identified as having an obesity problem. And I draw some of this from BMG's best practices. Research on obesity suggests that genes may play a part. And of course, it's rather obvious that there must be an environmental facilitation for this to happen, because children can't become obese under any circumstances, and the hereditary component of obesity can't alone explain this epidemic we've seen today, also because of the rapid increase the last decades. But there have been identified some risk factors for children that develop obesity. One of them is a rapid weight gain during infancy. If children are overweight or obese between 25 and 54 months of age, they increase the risk of obesity by 12 years by 5. Also, having obese parents is identified as a risk factor. Ethnicity has been pointed at in American epistemological studies. In American studies, there have been shown that obesity to be a larger problem in Mexican American and African American communities. Poor socioeconomic status is associated with childhood obesity, and generally sedentary lifestyle. Poor dietary choices is seen via increased energy intake, that being energy-dense foods, portion size, or sugary beverages. And also there's been identified that children that spend more than 2 to 3 hours a day in front of a screen tend to have a tendency to develop obesity, and also sleep deprivations. So if there is an irregular sleep pattern, or the children sleep less than they should, that is associated with obesity. When it comes to parents, it is of course conceivable that the childhood obesity can be a symptom of parents failing or falling short on their parental skills. I mean, one of the many important tasks parents have is to help children regulate their lives, not only their own food intake, but also their lives in general. Establishing a common eating pattern in the family. For instance, it's possible to ask what happens when children are left for themselves to find food when they're hungry. After school, parents are maybe not home a lot. And if this happens from a young age, then that might come into play. And also parents have a responsibility for regulating and enforcing rules when it comes to TV time and activating children and keeping a good sleep pattern. So that's a lot of thoughts that might come to mind when we think about parents' responsibility. But I would also like to point out that the apparent inability for parents to contribute to weight loss in children or failing to change habits can also have different causes. I think a lot of parents today fear to touch on the subject because of they might fear contributing to an increased body focus. They might fear contributing to a negative body image, or maybe they fear inducing eating disorders in their children. There's a lot of things written around in the press about how to talk to children about food, and it's always presented as a very touchy subject. So the fear is not. There's a base for that fear, I think, and self-esteem is often named. Maybe there's a general fear of adding to the burden or causing shame within the children. There is, which briefly was mentioned earlier, there is also this aspect that it is many people think that it's normal for healthy children to be a bit robust, and parents with obese children often tend to have a different view of their child's weight than others. And there's also this thought often that they might grow it off. And then there's an aspect of, I think, that's we could still see that body weight is often considered a private matter and best left unspoken about. Several of the risk factors that I mentioned so far have can also be attributed to trends and development in society in general. There are less physical activity now than there were some years ago, and there's of course that's a big discussion that we could take, but that might play a role. And also the risk factor of socioeconomic status might give us an idea of how parents can have challenges when trying to address this problem. For instance, if a parent has several jobs, or maybe lack a job, or not able to keep a job, they will probably tick off several of the boxes mentioned to increase the risk of obesity in children. It will be difficult in that circumstance to preserve a sound eating pattern and being a good model and keeping a tight ship, so to speak. It will be much more difficult. And of course, economy, as we've heard, energy-dense foods, they are generally cheaper to buy. That's the way it is. There's also a thing that a Norwegian study found that children with divorced parents run a higher risk of obesity. And in the same Norwegian study found that you run a higher risk of obesity as a child if you live in the north of Norway rather than the south of Norway. And also there are, of course, the psychological aspects of obesity. Loneliness, bullying, social exclusion, and that sort of thing. So there are many things that can also it's possible to understand that it can be difficult for children, for parents to help their children in this issue. So, a few words about intervention. When it comes to treatment of obesity in children, that is just about as difficult as treatment of obesity in adults. And research from clinics treating obesity in children and adolescents stresses that taking a multidisciplinary approach is very important. Despite all cultural and environmental factors that come into play in developing obesity, it's, I think, important to stress that it's a medical condition, and involvement from medical doctors and health service is essential in treating obesity. But it may also require assistance from physical therapists, nurse, psychologists, help to activate children on their free time, nutrition consultants that can help establishing a dietary regime, and there may also be a need for counseling on how to handle behavioral aspects necessary for achieving weight loss. So the difficulty of treating childhood obesity makes prevention obviously so much more important. Children grow, and that gives them an advantage over adults. If an intervention in early age can succeed in changing nutritional habits and activity level, there is a chance of success. So prevention, I think, is a very important factor. But to be able to intervene, it is, of course, essential to do screening, and it's because it is still rare to see parents seeking help in the health service for this problem with young children. In Norway, that is. So in Norway, public health clinics have kind of changed their attitude to obesity in children since the last decade. New governmental guidelines have led to more parent involvement. So, for instance, I can mention that before summer, I myself received a letter from the local public health clinic regarding my 13-year-old with weight curves and height curves and everything, and that was kind of new to me. So that parents are involved to a bigger degree than before. And also frequency of measuring height and weight have increased in Norway. And children showing an abnormal body mass index are followed more closely and receive counseling on diet and lifestyle. And also in the prevention area, it should be mentioned that focus on infant health and giving advice to parents regarding nutrition of infants and toddlers is important, since there is established a clear link between early onset overweight and obesity in later life. This includes the big culprit, sugary beverages, that I think has been there's been more attention to that in the last years. Lastly, I would just say a few words about involvement from child protective services. The child welfare model embedded in the Norwegian Child Protection Act gives local child protective agencies a lot of room to intervene preventively. And for instance, since obesity is associated with low income, there may be contributions like financial support in families unable to afford paying for instance, leisure activities for children. And child protection services may also be in a position to advise parents on lifestyle changes and strategies to adopt a healthy food regime and more active lifestyle for children. And they may coordinate the multidisciplinary involvement in the family necessary for the public to intervene and be helpful. So I just would like to say that I do believe that the state has a responsibility in both preventing and treating child obesity. The public health services need to take an active stand, in my view, in addressing this problem by monitoring and communicating the results. And also, I think there is. I just mentioned that there has been this change, and I think that's for the good. And in fact, there is evidence to suggest that the number of children that are overweight and obese in Norway has stopped to increase from 2008 to 2015, and maybe there is a reason for that. Okay, thank you.
Hi. Yeah, well, it was really nice to listen to you, and I think you said a lot of things that I was thinking on addressing on this short presentation. This thing of child obesity has been in the debate in Latin America for the last year, especially related to food labeling and how we are informing people about food and what are the food labeling and that's in the supermarkets. During all these debates, I am going to start with something that is a personal experience to show you what is my take on this issue. I was discussing with some friends I work on non-communicable diseases, like diabetes and child diabetes and that, and they has been making research following cohorts and that in the case of Peru, and there was this workshop with people from Colombia, Mexico, Chile. And then when they presenting the results, it's public health people and a lot of medical doctors, and they start to present a list of risk factors, as obesity was a thing of like individual risk factors. No? And then you have poverty, the level of education from the parents, living in a slum, working hours from the parents and that. So then I say to them, okay, so you are having these risk factors. We present the same risk factor for tuberculosis. We are going to have the same risk factor for children that are not going to adhere to cancer treatment. We are going to have the same risk factor for multiple diseases. So probably it's not just a thing of risk factors. It's not that risk factors are not important, but they are not telling nothing. These are the same risk factor for multiple health conditions. So probably we need to think in other things. And then so who is getting obese? Who are the childs? Where are the childs? And they didn't have this disaggregate data. So it's like, let's try to look for where are these children, from where you have the data. And in many cases, for a case in Colombia, in Peru, the children were in the main cities. So it's a thing. It's not that children in rural areas are not getting obese, but the trend has been much more radical in big cities. And then we have to start to discuss how is the life of these children in these cities. And they didn't have any data. So I say, okay, so then we have to start to try to understand. Okay, parents working in the informal sector, working 12 hours, children that have to travel 2 hours to go to the school, and this is not rural areas. I mean, children in Lima, or I met a child in Colombia that they start the school at 7 o'clock, so they have to wake up at 4 o'clock to go to the school, and that is the reality in the cities. All that can contribute to the risk factors that has been mentioned, but it's not just like a risk factor without the context. So we have to understand the context where these risk factors are. Then they were speaking on what we can do on this, and then some policy interventions and trying to generate data for the food labeling. One of the pioneers countries in Latin America was Chile, that decided to go from to put information about this food have high content of salt, sugar, and that kind of things. And Chile did some research and showed that the best thing of doing this is to put octagons, just saying high, or medium, or low, not putting more information. But then comes the other issue of the food companies. They were fighting crazy in Chile at the level of the parliament, so this is also really interesting, so probably we can make a project on the lawfare around food and food labeling, because it was really interesting how in Chile they start to present and all this idea that you cannot intervene on the decision, it's the decision of the parents, this is going to be Cuba, you are crazy, this is a democracy, and say, okay, but it's just how to present information in the best way. And which evidence is going to be taken or not taken, or just no, this is not serious, this is serious, and all the people from public health were saying this is a thing of evidence. I was telling to my friends in Peru, this is a thing of politics. You have to go to the Congress, you have to start now to try to gain some votes for this, because this is not a fight of evidence. The debate coming in Peru, there has been 4 years of debate around this issue. And again, it was the Minister of Health, that is supposed to be the authority on health, they managed, because it's public health people, we managed to convince the people in the Minister of Health to make the octagons and not the traffic light system. The traffic light system to label food say, per each portion that you eat, you have a high level of this. So it's really complicated, have a lot of information, so it's much more difficult to understand and to follow that the octagons ones that say high, medium, or low. Even though the food industry have money, and parliamentarians need money, I think, for the campaigns. So then this was, they decided in the first decision at when they were regulating the law to pass the recommendation with from the food industry with the traffic light labeling. And that was a disaster. So, and then they were really frustrated saying, I mean, why this is going, I mean, why we have the evidence? You don't have the political power. So it's not just a thing of evidence and which evidence is going to be taken. It's a sector that is a lot of money there, and it's a sector that you have to fight and to see what are the interests. But at the end, we have the octagon system because there was a crisis in the government, and then we managed to put it, and then it's done. So there was a political window of opportunity. So these are the things that we have. We have in Peru, we have in Chile, Argentina, Brazil, Colombia, Uruguay, that also have problems with obesity. This is just in project. This is a lot of lobby at the legislative level that this is not going to pass. But in countries like Colombia, they have a really active constitutional court that are making a lot of decisions on social issues. There are some people that have been bringing this to the courts. And there was one case that was won in 2017 regarding soft drinks. And there was a commercial, and everything was perfect. And there was this organization, civil society organization of consumers saying the information is not okay. I mean, they are not just saying that we drink this and we are going to be happy, rainbows and that, and we are going to be fat. So they also have to say the side effects of this. So then the minister, that was really interesting, because then you have the Minister of Health saying, yeah, we are with the consumers, but the Minister of to promote of Economy and the Minister of Industry say, no, you cannot do it because that is too much regulation. So they went to the court, and the court decided that access information on the positive and negative consequences that consume a particular product might have on their physical and mental integrity is part of the right to health. So there is so depends in the political structure that you have, in the opportunity that you have, in the institutions and all that, also these issues of child obesity and how to control it and the role of the state. So with that, so we don't have the perfect position in Latin America, where there is some developments and that are interesting to look probably for your study.
Thank you so much, three of you, for your contribution. Before I open up the floor for questions, I would like to bring in another dimension from sort of my own background as a sort of ethicist, because I wonder whether there's a different, another player in the equation. So we've mentioned the parents and we've mentioned the state and maybe multinational corporations, but what about society overall? Because I think culturally, for example, we are trained from very early on that sugar or unhealthy foods are something that we get as a reward, right? So you have done well in school, have some chocolate, oh no, I really deserve this, I had a tough day at work, I'm going to have some alcohol and some unhealthy food usually. With kids, hopefully not the alcohol so much, but still it's this idea that this is something that we get when something is good. So I think that is a very strong social association, and at the same time sugar is one of the most addictive substances that are out there. I mean, people now sometimes compare it even to nicotine in terms of addictiveness. I mean, that's maybe slightly exaggerated, but I think there's some truth in it that when you're used to sweet stuff, you crave it more, and so especially with kids that cannot conceptualize the problems behind this and why parents maybe say no, combined with the marketing that you've discussed, favorite Disney characters suddenly on your cereal package or whatnot, it's extremely difficult. And referring back to something that Norman Daniels mentioned on Monday, this idea of a moral versus a legal right to health, I'm wondering how unfair it is to us parents to feed their children properly when we do nothing to support them as a society in their venture, because I don't think we're going to just change the law so that no food marketing is going to happen anymore that's harmful. It would be nice, but I'm too pessimistic on that. So I wonder, is it even, can you even blame parents in the sense that you need the system change before you can say you're responsible in a sense that it will have an effect? Sveinung mentioned a lot of important factors that play into that, the background and the education, the access. But I'm just wondering whether sometimes we are too narrow, and maybe we should look at what we ourselves do, like what do we serve at our children's birthday parties, or what do we serve out here. I'm very happy in Norway to see lots of fruit and nuts, so this has been well noted. I was yes, but I was in the UK before moving here, and there was just chocolate, and crisps. So this is an improvement. So I just wondered if you had any thoughts on the sort of social responsibility for childhood obesity.
I just would like to say that I think it's a very interesting aspect that hasn't been talked about a lot, and I don't feel that I have a very insightful comment on it, other than I would like to mention that I think it's a very good point.
Okay. I agree, it's a good point, and I think it does, though, to an extent, go back to the marketing and also the depiction in media. So there have been some studies that have coded when healthy and unhealthy foods appear. And I'm really aware of this now. So if I'm watching TV, and if you actually pay attention to it, it is constantly, if you watch TV shows, if you watch movies, it's constantly unhealthy food. And this isn't just product placement, but it's in social setting, the girl or boy breaks up with their girlfriend, they come home to their mom, and their mom makes them something very unhealthy to eat. And, people get together and they eat very unhealthy food together. And it's really enhanced and encouraged by the media and in television. But then, of course, there's the other aspect of it. And I don't know, but what I know, for instance, from Denmark, which I was kind of shocked by coming from Ireland, is that in the kindergartens, which all children basically go to, many of them you're not allowed to bring any sugar. So they're like sugar-free kindergartens, and they don't use sugar as reward, so you don't have a birthday cake on your birthday or things like that. So I think there is a growing awareness. Maybe this is just a social utopia of Denmark. But for me, that was very unusual. So I think in some countries, there definitely is an awareness of not connecting reward and not connecting celebrations as much with unhealthy food.
Okay, interesting. Thank you. Any questions from the audience? I think we don't have a lot of time.